system in the country represents about 14% of the total GNP. It consists of hospitals and doctors and pharmacy companies and everything else. And what you are seeing in the country right now is a gradual shift from what I'd call fee-for-service, Blue Cross, Blue Shield, prudential type policies to what I call managed care. Right now, 51% of the people in the country are in managed care programs like Pheonix Healthcare Corporation. This is the kind of reform that's taking place. The problem with the healthcare system is we have about 37 million people out here that do not have healthcare coverage. I didn't say they were denied healthcare. They just do not have insurance coverage. They still get their healthcare, but they're just, we're paying for it out of our bad debts and things like that. The other thing about our healthcare system is cost has been rising rather rapidly. And as you can know, hospital bill, you can go in for one day and be charged $10,000. Well, that's quite expensive. So with the cost and the question of 37 million people, that's what's caused people in Washington to think about doing some kind of healthcare reform. But let me go back one more point. When Clinton came into the White House, we had another situation that was prevalent in the country. We had a recession. And we had a lot of people, because they were out of jobs, didn't have health care coverage because your health care is tied to your job. If you don't have a job, you don't have any coverage. And people were very apprehensive and very nervous about it. So that's what gave the push to get health care coverage. Well, the economy has gotten better. More people are working. In Nashville, the unemployment rate is 2.9%. So everybody's working. Since they're working, they have health insurance coverage. So there is no longer the clamor. That's right, it comes with the job. So there's no longer the clamor out here for national health care reform. But Dr. Haney, health care reform is going on anyway because the reform that's taking place is people are moving from the fee-for-service high-cost medicine to what I'd call the managed care, which is a more reasonably priced. You only have to worry about finding a doctor and then somebody manage through the system. And this kind of reform is going on and will continue to go on, whether we have national health care legislation or not. As a matter of fact, we're better off without national health care legislation if we want the transition to be smooth. If we had national health care legislation, we got regulations that we got to implement, and it might slow the process down. But it's gradually moving through, and I don't think we need too many things. If I was picking a couple of things that we should have in health care legislation, I would say, number one, we probably should have some kind of reform of medical malpractice so that the tort reform, we do need that for the doctors. Number two, we need to mandate programs like TennCare so that they can get out, many people can get covered, and I'll talk about TennCare in a minute. But we also need to handle the pre-existing condition. You know, a lot of people have a existing condition and they can't get coverage. Those things ought to be outlawed and made possible, and that's about the only reform we need to make, at least in my opinion, and the rest of it needs to be time, because it takes time to implement things.
And you said about TennCare. Now, not only let's talk about it, but let's talk about some of the motives behind TennCare. How is it that we came eventually to this point of having what we call TennCare? I mean, what created that kind of situation to make us end up in TennCare?
Remember I talked about the cost problem? Well, you had the cost problem in Medicaid. The state Medicaid...
Now, what is Medicaid?
Medicaid is a program for the poor. It's a health care program for the poor and the elderly nursing homes. That program is about to go bankrupt. We were going to have 1% sales tax increases every year in order to fund Medicaid in the state of Tennessee. But we couldn't do that. I mean, we already got 8.5% sales tax. You want a 9.5 next year, a 10.5? You can't continue to do that and maintain the same benefit level. Either you do that or you cut back on benefits. Well, the other alternative was to go to managed care. And let's put the management of those individuals into HMOs and PPOs, managed care organizations, and let them manage the care, hopefully more efficiently, and we save money. And that's exactly what happened. But more importantly, remember I talked about the 37 million that were uninsured? Well, in Tennessee, there are about 500 to 600,000 that are uninsured. Well, we have 750,000 Medicaid, and we now have insured 350,000 of that 500,000, which means we now have 1,100,000 people in the state with insurance, 350,000 who didn't have it before. That's the benefit, and we did it for the same dollars, that we had for Medicaid before, because it's a managed care system and not a system that's basically out of control. Now, that's the kind of system that we need at the national level. But we didn't have to do a lot of legislative writing. I mean, this was done administratively. So you don't need 535 individuals to agree. You can take a governor in the state of Georgia. He can do it in Georgia. You can take a governor in Florida can do it. Any other governor can do it. All he has to do is get approval from HCFA, and HCFA will give you approval to implement kind of a program.
Now, Tennessee sort of represented one of the first states to get the kind of approval that to step from outside of the federal mandate in reference to this Medicaid and to deal with that.
Yes, Tennessee is the only state that has a 1115 mandate, which is the HCFA mandate, for managed care throughout the whole state. You have some other 1115 programs, like Oregon has a program. We have a program in Hawaii. We have one in Rhode Island, and we have one in Arizona. I think Florida has recently been given approval. I think you can expect approvals in Louisiana, Ohio, probably Arkansas, Missouri.
And these approvals will be across the entire state?
Their approvals are for specific counties.
Okay.
They're not as bold as Tennessee was. Tennessee was a statewide, and it's the only statewide. But I think that most of them are going to look at
We've demonstrated
Yeah.
that it can be done on a statewide basis. Would that be fair in saying in reference to our TennCare?
It's reform on a statewide basis, and it was, I would say, it was not implemented with not a lot of agony. I mean, we all worked very hard and long hours, but you have 12 managed care organizations in the state of Tennessee that are delivering care to 1.1 million people. And you remember, all these people now have doctors that they can call. They don't have to worry about traversing what I'd call this complex medical system. They have physicians that they can talk to.
Now, looking at it from a physician